So let's go over the equipment that needs to be gathered prior to completing a pelvic exam and a pap smear on our female patients. The first thing you will need is a way to gather vaginal secretions to test for sexually transmitted infections. This is a commercially prepared swab and collection container to swab the vaginal canal, and you put the swab then into your container and send it to the lab. The next piece of equipment that is needed is a fairly large cotton swab. This will remove any excessive vaginal secretions prior to your pap smear. There's two techniques that can be used to gather the cervical cells. The first is with a cytology brush and a spatula. The cytology brush collects the endocervical and the spatula collects the exocervical cells. The other device that you can use to collect both those cells at the same time is the cytology broom. The point goes endocervical and you rotate the broom in a clockwise fashion to gather your cells. This container represents the thin prep container that you will put your collection tools in and swirl around to deposit the cervical cells inside the liquid that is in the thin prep container. It's also good to know that there are several sizes of speculums. On the table is a representation of a small, a medium, and a large. So you really want to gather the right size for your patient. And you also want to be able to play with opening and closing these. So really work with this tool prior to inserting it into your patient. You will need two sets of gloves, and you also will need lubricating jelly as you will put this on your gloved finger to do a bimanual exam.